Hi, you or your family member have been scheduled for a cardiac catheterization procedure at St. Michael's Hospital. We want things to go as smoothly and as comfortably as possible. This video is to help you prepare for the procedure and let you know what to expect on your day with us at the Cardiac Investigation Unit. Welcome to St. Michael's Hospital. St. Michael's is a provincial hub for the most complex cardiac and cardiovascular care. As a patient, you may also be given an opportunity to participate in clinical research evaluating tomorrow's treatments. You will meet not just your heart doctor, but a team of highly qualified professionals during your stay, including registered nurses, specialized in cardiac medicine, resident physicians in advanced specialty training, medical X-ray, and cardiac technologists. Your cardiologist has referred you to us for a catheter-based procedure, either a cardiac angiogram for diagnosis or a coronary angioplasty or stent for treatment. A cardiac catheterization is a diagnostic procedure to see if there are any blockages in your heart arteries or problems with the valves or pump. A fluid called contrast or dye is injected through a catheter into your heart arteries or heart chambers. X-ray movies are taken during these injections to show the inside of your heart. The most common treatment done in the cardiac catheterization laboratory is a coronary angioplasty, a procedure done to treat important narrowings that obstruct blood flow in major heart arteries.
Hi, my name is Dr. Wasef. I'm an interventional cardiology fellow at St. Michael's Hospital. The two most common places to get access are in the femoral artery, which is in the upper part of the thigh here, where we'll put a introducer sheath like this into the upper part of the thigh, and this will allow us to advance the catheters to your heart. The other place is in the upper part of the wrist, just below the thumb here, where a catheter will be inserted.
One of our staff members from the Cardiac Investigation Unit will contact you on the phone to schedule your cardiac catheterization test. The first thing you need to do is get a set of blood test and ECG test at a lab near your home. Your heart test may be delayed if we do not have your blood and ECG test results. Please call your case manager if you do not have the requested tests done before the date of your procedure. You will need to arrange for someone to drive you home after the heart test. You are strongly advised not to take public transportation, and you are not allowed to drive for 48 hours after your heart test. Clear your schedule. Be ready to spend all day with our team in the hospital. Emergency cases may push your test to a later time slot of the day. You may wait anywhere from 1 to 6 hours for the test from your scheduled appointment time. What to do the night before your heart test. Step 1. Take out and write down all the medications you are currently taking on the medication information form. Step 2. Pack your bag with your health card, all of your medications you are currently taking, completed medication list, instruction letter, and information packet from the case manager. Step 3. Stay hydrated by drinking a lot of low-sugar, non-caffeinated beverages. Plain water is the best option. In the morning of your heart test, it is important to take all your usual heart and blood pressure medications unless your doctor and case manager told you to stop. Before you leave your house, make sure to bring the bag you packed the night before and ensure that you have a ride home. There are 4 entrances to the hospital. We recommend you enter through the Queen Street entrance. The Cardiac Investigation Unit, also known as CIU, is located on the 7th floor Cardinal Carter wing. Take the north elevators. When you step off the elevator on the 7th floor Cardinal Carter wing, you will be directed to wait in the patient and visitor waiting area outside the Cardiac Investigation Unit. The nurse will ask you questions about your health history, take your vital signs, and review the medications you are taking. Remember to bring all your medications as well as the list of medications you are currently taking. The nurse will then disinfect and clean the skin and insert an intravenous into your arm. The doctor will talk to you and get your consent for the procedure while you are waiting in the CIU. A nurse from the procedure room will come and take you on a stretcher into the room. Once you are in the room, you will lie flat on a narrow table under an X-ray camera. When you are comfortable on the table, You will be asked not to move any parts of your body unless asked by the doctor or other staff in the room. The team in the room will use a cold and wet solution to clean the areas where the test equipment enters your body. These areas could include top of your leg and your wrist. The team will put a sterile drape over your body. Before the test begins, the nurse will give you medications in the IV to help with any anxiety or pain you may experience. However, you will be awake during the procedure. Once you are prepared, the doctor will enter the procedure room. The doctor will begin by putting a local anesthetic to numb the area where a long, thin tube is placed inside an artery. The tube allows access for other equipment to be guided into your heart. The freezing medicine is so you do not feel any pain or discomfort. After the test is done, the CIU team will help you move to a stretcher. If the test was done through the wrist, the doctor will take the tube out in the procedure room and put a tight clamp around your wrist to stop the bleeding.
Hi, I'm Dr. Buller. I thought I'd come and introduce myself to you and make sure that we'd answered any of your questions. Naturally, we can't put catheters into the heart without some small risks, and there are some small risks to this procedure. For healthy people, the risks are pretty tiny, but they do include the risk of major heart attack, the risk of stroke, which can be very serious, and of course, a tiny but definite risk of death. And sometimes the X-ray contrast we use can be difficult with respect to kidney injury, and sometimes people have allergic reactions to the medicines and to the contrast that we use. But we're prepared to handle that, and this is a very experienced center. The team is all very experienced, and if we do encounter a complication, we know how to deal with it promptly. Sometime before you go home, either the fellow or I will come and have a conversation with you and your family. Make sure you understand the results of the test, whether any other tests or appointments are necessary as a result of it. And we're going to give you a diagram that shows where the blockages in your heart are, and we'll go over that with you and suggest that you keep that with you for your future medical appointments with your specialist and with your family doctor.
Thank you for taking the time to prepare for your procedure. We hope this video has helped. The CIU team at St. Michael's Hospital has a strong commitment to comprehensive patient care and look forward to meeting you on the day of your procedure.